approaching the patient, I'm going to check for scene safety. So I'm looking for any slips, trips or falls or any hazards. I can see that the room is clear and there's no hazards, so I declare that the scene is safe. I'm going to close the door or pull the curtain for my patient's privacy and dignity, and I'm also going to do hand hygiene, following WHO steps for hand hygiene. Palm to palm, back of the hands, fingers interlaced, fingers interlocked, rotation of thumb, fingertips, and let it air dry for 30 seconds. Hello, my name's Rebecca. I'm one of the nurses on the ward who's going to be looking after you today. How are you doing today, Carol?
I'm feeling much better, actually.
Okay, great. So I'm going to be doing your 12 o'clock medications today, but before I start, I'm just going to check some ID and things, if that's okay with you.
Okay.
Can I please just check your ID? Can you tell me your full name, please?
My name is Carol Young.
Okay, and your date of birth, please?
24/11/1940.
Lovely, and I'm just counter checking that with my documentation and your wristband, and everything is correct. And I can see that you have on a red wristband, an allergy wristband. Do you have any allergies to any food, drugs or latex?
Yes, I'm allergic to latex.
Okay, and what happens when you come into contact with latex?
So I normally would have rashes on my extremities.
Oh, okay, I'm sorry to hear that. Just rest assured that I won't be using any latex today, and I will be using latex-free gloves also. So I'm happy that I have got the correct patient. All of my details match. What I'm going to do next is I'm just going to check all of the address graphs are all correct and the ID matches also. Okay, so I'm happy that everything matches and my documentation is correct also. So as I said earlier, Carol, I'm going to be doing your 12 o'clock medications. So do I get your consent to proceed?
Yes.
Okay, brilliant. Okay, Carol, so what I'm going to do now is I'm just going to read through the prescription, okay? So I've got here, your name is Carol Young, date of birth is 24/11/1940, hospital number is 0004321, and that matches your wristband. Height is 1.57 metres, weight is 74 kilograms, body mass index is 25.6 metres squared. Ward is medical assessment unit. Date of admission is today, the 11th of March 2024. Consultant is Dr. A. Richards. Time of admission is 10 a.m. So I now have here prescribers. I have a Dr. P. Wright, GMC number 3214213. I have Dr. P. Wright's signature and bleep number, which is 642. So I'm happy that this is a signed, valid and legible prescription. So next I have details of persons administering medication. So I have a staff nurse, Laura Beale, who's already administered medications. Base is surgical assessment unit. Next I have allergies, I have latex, and effects is rashes, which you've already confirmed with me, so I'm happy with that. So I'm happy that that prescription's signed, valid and legible. So moving on to the next page, I have once only medications. So you have actually received salbutamol 200 micrograms via inhalation at 10:30. So how do you feel now, Carol, after having your inhaler?
I'm feeling much better, actually. Thank you.
Okay, that's great. So moving on to the next page. So moving on to prescribed oxygen. I can see that you're not a CO2 carbon dioxide retainer, so I'm happy with that. So I can see here, Carol, that you have a target oxygen saturation level of between 94 and 98%. And I can see that your oxygen has been prescribed and you are currently on 3 litres of oxygen via nasal cannula. So I'm just going to double check. How do you feel at the moment?
I'm very comfortable with the oxygen. Thank you.
Okay, great. Ms. Assessor, can I just ask what is my patient's current oxygen saturation level, please?
97%.
Okay, thank you. So looking next at antimicrobials, I can see that you are prescribed azithromycin. Today's date, which is the 11th of March 2024. The dose is 500 milligrams. The frequency is once a day. Route is per oral. Duration is for 3 days. Start date is today. The indication is for chest infection, which is due at 12 o'clock. And I can see prescriber's name and signature there, Dr. P. Wright, bleep number 642. and pharmacy check also. So I'm happy that this prescription is signed, valid and legible. Okay, so Carol, some side effects of azithromycin include sometimes you may have rashes, or sometimes it can cause abdominal discomfort. Okay, just to let you know about those side effects. So moving on to the next medication, which is regular medications. We have here montelukast. Today's date, which is the 11th of March 2024, the dose is 10 milligrams, frequency is once a day, route is per oral, duration is for 7 days, and it is prescribed time is 12 o'clock. The indication for this drug is prevention of bronchospasm. I can see their prescriber's signature, which is Dr. P. Wright, bleep number 642. Also, this drug has been checked by pharmacy. I can see that this prescription is signed, valid and legible. So also, just to give you some side effects of montelukast, sometimes you may suffer with diarrhea and sometimes fever also. So moving on to the next medication, which is levothyroxine, which is signed for today, the 11th of March 2024. The dose is 12.5 micrograms, frequency is once a day, route is per oral, duration is ongoing. Time, I can see that you've already had that administered at 9 o'clock. So staff nurse Laura Beale is signed for that one. So I'm just going to move on to the next page, which is as required medicines. So we have here paracetamol, which is today the 11th of March 2024. The dose is 1 gram, frequency is 4 to 6 hourly, the route is per oral, duration is for 7 days, and the indication there is for pain/fever. So I have their prescriber's name, which is Dr. P. Wright, and signature, and also bleep number 642. So I'm happy that this prescription is signed, valid and legible. So sometimes with paracetamol, you may get some abdominal cramps and sometimes diarrhea. Okay.
Okay.
So Carol, can I just ask, do you have any pain at the moment?
No, at the moment.
Okay, that's great. I'm happy to hear that you don't have any pain. Mrs. Sissa, can I just double check what's my patient's current temperature, please?
It's 37.4.
Okay, great. So because your temperature is within the normal range and you don't have any pain at the moment, I'm not going to give the paracetamol today, okay?
Okay.
So moving on to the next page, the last page, which is infusions. You have no infusions prescribed, and omitted doses of medication. I have today's date, which is the 11th of March 2024, levothyroxine, dose 12.5 micrograms, route per oral, instructions for hypothyroidism, and that is because you've self-administered this drug. This has been signed by staff nurse Laura Beale. Okay, so basically I'm just going to give you an overview of what drugs I'm going to be administering today, Carol. So today I will be giving you your azithromycin, which is your antibiotic, and also your montelukast, okay, and that is for your prevention of the bronchospasm. Are you happy with me to proceed? Do I get your consent?
Yes.
Okay, brilliant. So I'm just going to do my hand hygiene and prepare my equipment, okay? If you need me, the call bell's here, just please press the buzzer.
Okay, thank you.
Thank you. So I'm going to do my hand hygiene following WHO steps of hand hygiene. Okay, so Mrs. Sessa, may I just ask, is my tray reusable or disposable, please?
Disposable.
Okay, thank you. I'm happy that the tray is nice and clean. It's dry and intact, and I'm happy to use that. So I have my prescription here open ready. I have a glass of water for my patient, and I have medication pots. So I'm going to get 2 of those out because I'm only given 2 drugs today. So I have here azithromycin 500 milligram tablet. Expiry date is 25/12/2026. The bottle is dry and intact, and I'm happy to use that. It matches my prescription also. So I just want 1 tablet. So, Mrs. Sessa, can you just confirm that that's 1 tablet azithromycin?
Yes.
Thank you. So I'm just going to turn the page to my Montelukast prescription. So I have here Montelukast 10mg tablet. Expiry date is 25/12/2026. The bottle is dry and intact and I'm happy to use that. So I need 1 tablet. So assessor, can I just confirm that that is 1 tablet Montelukast?
Yes.
Thank you. So I'm happy that I have my medications here. I'm now going to approach the patient and check that my patient's swallow is okay. So Carol, I'm back. Just before we start, I'm just going to make sure that, are you in a comfortable position? Can I sit you up at all?
Yes.
Okay, brilliant. Okay, Carol, so before I administer the medication, I would just like to check your ID again, please, if that's okay. Can you tell me your full name, please?
Yes, my name is Carol Young.
Yep, and your date of birth, please?
24/11/1940.
Lovely. Do you have any allergies?
Yes. I'm allergic to latex.
Okay. And what happens when you come into contact with latex?
I have rashes on my extremities.
Okay, well, don't worry, I'm not going to be using any latex, okay?
Okay.
So I'm happy that you're in an upright position also, Carol, before we administer the medications. So next, could I just offer you a drink of water just to check that your swallow is okay, please?
Okay.
Okay. Okay, so have you swallowed that okay?
Yes, thank you.
Okay, brilliant. So first of all, we have your azithromycin, which is 1 tablet, and as I said earlier, this is for this is your antibiotic. So if you'd just like to take that one, please.
Okay.
And then just have a little drink of water. And can I just ask you to open your mouth?
Opening my mouth.
And it's gone yet? Brilliant. So next we have here 1 tablet. This is your Montelukast, and this is for your prevention of bronchospasm. So if you'd just like to take that one, please.
Okay.
And then have a little drink of water. And then if I could just ask you to open your mouth, please.
Opening my mouth.
And it's all gone. Brilliant. So are you comfortable enough there, Carol?
Yes.
Okay, great. So if you do experience any of the symptoms that I mentioned earlier, please just press your buzzer. We'll be around to assist you anyway, and we will be monitoring you after 30 to 60 minutes after administering the medication, just to check for effectiveness and also to check if you're suffering with any of the side effects. Is that okay?
Okay.
Yeah. Okay, well, please feel free to press your buzzer if you need us, but otherwise I'm just going to take off my PPE and complete my documentation.
Okay.
Okay, thank you. So before approaching the patient again, I'm just going to make sure that I do my hand hygiene, following steps of WHO hand hygiene. Hi Carol, I'm back again. So the 30 minutes has passed since you had your last medications at 12 o'clock. So I just wanted to check, how are you feeling at the moment? Are you comfortable?
Yes, I am.
Yeah, okay. And you're not experiencing any of the side effects that I mentioned earlier?
No, I'm okay at the moment, yes.
Okay, that's brilliant. So just as I said earlier, if you need anything, please press the buzzer and we'll come and assist you, okay? So thank you very much for your time today.
Thank you.
Okay, thank you. So assessor, I'm going to end my station with hand hygiene.